பலூனை தொலைச்சுட்டு இந்த பிளாஸ்டிக் பைய கொண்டாந்து வச்சிருக்காங்க, இதை ஊதுங்க இந்த பைய இருக்கானே.
Good evening. On behalf of IIP technical team, I welcome you all to this webinar on upper segment pain management through breathing technique in KCAT way. Today's webinar is being streamed live on IIP India YouTube page. Please subscribe to our channel to get regular updates about our webinar. Today's webinar is being hosted by IIP and IIPWC of Maharashtra State. The coordinators, moderators for this webinar are Dr. Darshana Trivedi, Joint Secretary of IIP Maharashtra, and Dr. Snehal Patel, Joint Coordinator of IIPWC Maharashtra. If you have any questions during the presentation to ask to the speaker, please put them in the chat section. It will be addressed at the end of the presentation. Now I ask the moderators to start with the session.
Yeah. So good evening to everyone. The one more session is. Am I audible?
Yes, sir.
Yeah.
Sir, Darshana will speak. Then you will start.
Yeah. Yeah.
Darshana, share your screen. Darshana, can you hear me?
Yes, ma'am, I can hear you.
Okay.
Can I share my screen?
Yes, yes.
Yes, thank you. Is my screen visible?
Yeah. Pick it in full screen.
Is my screen visible, ma'am?
Yes. Yes.
Yeah. Am I audible also?
Yes, yes.
Okay, thank you. Hello, good evening, one and all. Welcome, dear participants. Myself, Dr. Darshana Trivedi, Joint Secretary, IIP Maharashtra State. This is my pleasure to introduce to you all our central IAP team members, Dr. Sanjeev Jasar as our IAP National President, Dr. Suresh Babu Reddy as Vice President, Dr. K.M. Annamalai sir as the General Secretary, who is also fortunately our speaker for today, Dr. Ruchi Varshne ma'am, who is the national head for IAPWC, as well as she is the national treasurer for IAP. Dr. Nehal Shah ma'am as joint secretary, West Zone, and Dr. Sudeep Kare and Dr. Achal Vashi as our CEC West Zone members. Next, I would like to introduce IAP state team members, Dr. Ujjwal Yevle as the president, Dr. Amit Gire as vice president, Dr. Bharti Dave as general secretary, Dr. Sucheta Gulhar as Dr. Mansi Mehta as joint secretaries. Our state EC members include Dr. Sanjay Rajhans, Dr. Sohan Shelar, Dr. Suraj Kanse, Dr. Rahul Deshmukh, and Dr. Asmita Mahorkar. We also have our co-opted members for EC, Dr. Suvarna Ganveer ma'am, Dr. Snehal Patel, and Dr. Uttara Mohan. This is our just a minute. Now I would like to Now, dear participants, I would also like to introduce to you all our women's cell members, Just let me give you a gist of IAP Women's Cell. IAP Women's Cell was started on 30th of May 2018. It functions under the guidance of National Head Dr. Ruchi Varshne Ma'am and IAP President Dr. Sanjeev Jha sir. IAP Women's Cell works towards conducting public awareness camps, CMEs, and workshops. It aims to bring together all physiotherapist professionals for sharing knowledge and improving public awareness among physiotherapists. In IAPWC, we have 5 zones in India. With heads of each, Dr. Pooja Kamble ma'am is the West Zone head. Now, our IAPWC state team includes Dr. Suvarna Ganveer ma'am, who is the state coordinator, Dr. Snehal Patel, the state joint coordinator, and the sub-coordinators are Dr. Uttara Mohan, Dr. Priya Karande, and Dr. Nirali Sanghvi. IAPWC Maharashtra has conducted 40 plus low-cost activities in various districts. In the first corporate IAP conference held in Indore in April 2019, Maharashtra State has received award for Best IAP Women's Cell. With this, I would invite Dr. to please introduce.
Good evening, one and all. Myself, Snehal Patel, Joint Coordinator of Maharashtra IPWC. So it is a great pleasure to meet Dr. K.M. Annamalai sir. He is a MPT in Cardiorespiratory. He is a General Secretary of Indian Association of Physiotherapy. He is a Chancellor of Gandhi Rural Institute under the Ministry of Human Resource Development. He is the Chancellor of Gandhi Rural Institute under the Ministry of Human Resource Development, Government of India. He is the HOD Department of the Physiotherapy and Rehabilitation, Apollo Hospital International, Ahmedabad. He is a Director, Alliance of Physio Solution. He received the Blue Ribbon Award and Socrates Award from the Oxford, United Kingdom. And he is also founder of the KCAT Techniques. I welcome you, sir. Please take over.
Hello. So once again, thank you so much for the team Maharashtra, specifically Women's Cell, which is always exclusively staying apart from all the team and already proven got the award in Indore. So I think my best wishes and congratulations for still perform better and better years to come. With that note, I would like to thank to Team Maharashtra of IAP, as well as the President, Vice President, Secretaries, Joint Secretaries, CC members and coordinators. And specifically thanks to Suvarna Madam, who was just chasing behind me for a date and to conduct this workshop. I really appreciate your effort and thank you, ma'am, for your wonderful opportunity you have given. And also my IAP colleague of Maharashtra, Ujjwal sir, Amit, Bharat, everybody I want to just thank for this opportunity. And our zonal heads, Achal, Nehal madam, Sudeep sir, and everybody, once again, I would like to thank. And now today we are going to talk something regarding a KCAT. KCAT is one of my own technique coined by myself. And I'm not coined anything. I just found out this as a good way of practice, which I used in my patients. And I took a lot of inspiration from a lot of indigenous methods of operation. So based on that, I tried to create some evidence-based methods. So those evidence-based methods are mostly sonography-based evidence methods. So which has helped me to stand in front of the foreign speakers over there to present my presentation, and they are gracefully accepted. And with that idea, I started to develop different way of thinking of different organs and different physiology and different way of looking into anatomy physiology. I'm not changing any anatomy physiology. The way of looking of anatomy and physiology from my perspective is KCAT way. So in that sense, today I'm going to talk about something. I want to share first, something like that. Everybody can see this? Everybody can see this? Hello, can you see?
Yes,
sir, it is visible.
Yeah. So my topic is today, the upper segment chronic pain management through breathing technique. So the first and foremost, this is my favorite slide. So nowadays we are living in a very busy world. In spite of Corona, our brain is keep on running. It is something like a rapid movement happening around our brain, which is continuously in and around. We are thinking a lot of process. The toughest job is sitting, stay idle without thinking anything with a blank space in the mind is the toughest part. I think everybody will agree with this. So because the human mind on this era is keep on running about the ambitions and about the life and about the achievements or about the things or depression or they want to be happy. They are just searching for joy and everything. So it's not just a comfortability or they are just fighting for the existence or for the rights and power and money, power, sex, lot of things and love. So it is a mind is a completely all the GBs are occupied by predisposed thoughts. So everybody agree with this point. So nowadays in English we are human beings, but nowadays unfortunately we become human doings because we do from the morning to night, and especially before COVID, the life was horrible. Everybody will do. But most of them are ambitionless, aimless life because they are human beings rather than they have become human doings. Because we always doing. We do not know why we are doing, what we are doing. So we are just on the rush. It's a fact of life. So anybody is having a time to understand that. Did you know that average person takes you 23,000 breath each day? How many do we even notice this? We don't have a time because we are so busy with a lot of priority things, but we forget about our primary things. The primary things are priority, people forget about it. So do you know that average person takes 23,000 breath every day? It's not a joke. 23,000 times your lungs are just expanding and closing. And 23 times that lungs are supplied by the nerves, which is actually accelerating the electrochemical charges. And the 23,000 times actually your diaphragm is working. 23,000 times your diaphragm is massaging your internal organs. And 23,000 times your nasal airway is kept patterned. So 23,000 times your upper respiratory tract is kept on beautifully opened for allowing the air inside. What not? It is a great work. It's an art. It's an art of work, actually, a piece of art made by the God. So how many times we notice? Okay, if I ask anyone what is breathing? Breathing is a simple process, just breathe in and breathe out. It's just tip of the iceberg, what we know mostly. So most of us, if we ask what is breathing, they will say that you take the air in and take the air out. So it's called breathing. That's correct. It's correct. But it's a tip of the iceberg. So below the iceberg, there is a lot of things to understand about the breathing. Breathing is a most complex and unique process in the body of physiology, which is made by the great creator God. The tip of the iceberg means a small indication, which means a big problem behind it. Okay. If I ask what is the normal breathing, somebody says thoraco-abdominal breathing. Somebody says abdominal thoracic breathing. Somebody says, sir, you have to breathe slowly. Somebody says that moderate breathing. Somebody says that effortless breathing. Somebody says that the breathing should be normal only if you are rapid. So actually, what is normal breathing? Many people do not know. There is no word called normal breathing because the breathing is a very good modulator. It always modulates according to the need and requirement. You see these three diagrams, the beautifully amalgamated. The first fellow is running for a 100-meter race in the Olympic, who is running it fast. So his muscles require a lot of oxygen. So the oxygen depth created. So because of the oxygen depth created, so he has to fulfill the oxygen need of the each and every muscles. So what he will do? Immediately he will start to breathe very fast. So it's a shallow, deep breathing. So we can call it it's a shallow breathing or deep breathing, and it's a rapid breathing. So for this guy, once you ran and he's completed his 100-meter dash, if he is going to breathe it rapidly for next 5 minutes, and which is going to be absolutely normal breathing pattern, you cannot call it as abnormal breathing pattern because he is doing rapid or shallow breath, because he want to just compensate the oxygen depth. So for him at that time, at that moment, that is a breathing pattern, is a right breathing pattern. Suppose he is running 100-meter dash, at the end of the 100-meter dash, he is not going to breathe rapidly. That means it's not good because he is not going to manage his oxygen demand of the body. So that's why I'm saying no breathing is called as a normal breathing or abnormal breathing. The moment will make you to understand your body to modulate the breathing patterns. So if you see the ballet dancer, so this ballet dancers always breathe very rhythmically along with the movement of the body. So they sway like a swimming or something like a fish, actually fins or tails are moving like that. So basically they are just slow rhythmic breathing. So this rhythmic breathing also you cannot call abnormal breathing because that breathing is required for ballet to maintain the accuracy and achievement of balance on the toes. Similarly, if somebody is breathing very slowly, relaxedly with the expiration more long, om kind of, or they are meditation, doing the meditation, they are breathing a long breathing out. So that is a need of that. So it is actually not, you cannot call that its rate is very less, so it is not a normal breathing. So this is normal breathing for yoga. So the activity demands the breathing and activity decides the breathing pattern. So there is no regularly normal or abnormal breathing pattern. The good breathing pattern means your breathing pattern can be able to adapt to the requirement of physical requirement or mental requirement. Then you have a good breathing pattern. Okay, let me talk about sympathetic and parasympathetic nerves. Many people knows that the parasympathetic nerve is for good food to eat and relax and digest and rest. Whereas the sympathetic nerve is for fight, flight. Suppose a lion is coming, your sympathetic overactivity gets started. Whereas you want to do a yoga, your parasympathetic activity gets started. You want to relax, massage, your parasympathetic activity gets relaxed, started. And you want to eat the good food with good swag or just good taste or good flavor. So actually your parasympathetic activity gets started. So basically the sympathetic and parasympathetic activities are maintaining not only your heart and also maintaining your lung function. So this is actually, so what you can see means, if you see the parasympathetic activity here, it is actually constrict the people and stimulate the saliva. So salivation is very important for digestion and slow down the heartbeat. So slow down the heartbeat means each heartbeat will become more efficient to supply a very good amount of systemic circulation. And constricted airway, the airway get constricted and stimulate the activity of stomach. So inhibit the release of glucose and stimulate the gallbladder and stimulate the activity of intestine. So intestines start to go peristalsis smoothly and crack the bladder and promote the erection of genitals. So if you go for a sex, or if you go for a good food, or if you go for relaxation, everything is rely on your parasympathetic. So the sympathetic, it dilate the pupils and inhibit the salivation and increase your heart rate and relax the airway and inhibit the activity of stomach and stimulate the release of glucose, inhibit the gallbladder, and inhibit the activity of intestine. So that's very important. If you are going for somebody's funeral, you won't feel hungry because reason is you inhibited the activity of your intestine. It secretes the epinephrine and norepinephrine and relax the bladder and promote the ejection and vaginal contraction. So basically the sympathetic overactivity is for sustaining for a temporary purpose to protect you from the danger. It should not be a regular activity of your life. If it is going to be a regular activity of life, we are going to call the term called stress. And if it is not going to, it is going to come now and then, then it is just a mechanism to protect you from the danger. Whereas the parasympathetic activity should be always a sustained, but unnecessary because of we are converted ourselves from human being to human doings. Nowadays, we are more reliant on sympathetic nerve activity. We are less exposed to the parasympathetic nerve activity, which is an unfortunate again. So this is a Maslow's hierarchy of needs. So if you see the Maslow's hierarchy of needs, the base is called as very, very important, because without base you cannot make a house of the top. So the tip of the triangle cannot be achieved if you don't have a strong base. In the strong base, what are the things they have written? Physiological: breathing, food, water, sex, sleep, and homeostasis and excretion. In all these factors, if you take the first point, the Maslow's also says that breathing. So without breathing, no life. The breathing is everything. So look at that. Breathing is a first point of, so it's a physiologically also very, 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 very important. Okay, let me talk about a little further into breathing. Now we have seen the importance of breathing and how breathing has been inculcated in our lives. Now I want to show something like how the breathing is controlled by the nerves. So I don't want to lose one important nerve regarding the breathing. I love this nerve. So this nerve is called as phrenic nerve. So this phrenic nerve is, the great part is, it starts from, you see this picture, C3, C4, C5, anterior rami, it passes through scalene, and also it passes through the pleura, which is a covering, which is a shirt, a layer covering the lungs, pleura, and also it covers the pericardium, and pericardium is a mediastinal space, it is a covering for your heart. So which is also continued to be a great wall of China. Diaphragm between the thoracic cavity and abdominal cavity is diaphragm. So both right and left diaphragm is totally covered with this phrenic nerve. So it is also supplying a supplement branch to the shoulder tip. So most of the time the tip of the shoulder is always associated with your breathing problem or your diaphragmatic problem or your gastritis. That also reason for your shoulder pain. This is one of the clinical evidences or clinical pearls. So the C3, C4, C5 is a very, very important segment which is giving to the phrenic nerve. The phrenic nerve is basically, it is both motor and sensory. Okay, let us talk about the breathing. So how we'll see, it is a mechanical process with the fueling the respiration. So what I want to say is how it is a mechanical process. A diaphragm moves down, a diaphragm moves up. Diaphragm moves down, diaphragm moves up. When it moves down, it is an inspiration, and when it moves up, it is an expiration. So it's a mechanical process. It keeps on moving. Similarly, your rib cage is opening and closing. Your frontal axis is and closing, opening and closing, and anteroposterior also is open and close, open and close, open and close, something like this. Okay, so all these dimensions are opening and closing, opening. So it is mechanically, it is just fueling. So because of this mechanical movement, which create internally the difference of pressure. So due to this difference of pressure between the atmospheric pressure and internal thoracic pressure, intra-abdominal pressure, the air is getting attracted into the lungs. So basically, this is basically that lungs which is receiving the oxygen. So then it starts to become a chemical process. So mechanical process is fueling the chemical process. So which is a primitive process. The mechanical process is a primitive process. The mechanical process fuels the process of respiration, which is at the alveolar level. So from this alveolar level, the oxygen is used by again the mechanical process as a fuel. So it is vicious cycle. The mechanical process fuels the respiratory process, and respiratory process further fuel the mechanical process. It is a continuous cycle. So it's a motor behavior. Yeah, we accept it is a motor behavior. It's a synchronized muscle work. It's not a single muscle. I won't say it is a diaphragm. It is a diaphragm, but diaphragm has to go and work related with a lot of cooperation of different kind of, no operation without cooperation. And airway patency is very, very important. The patent airway, if there is any problem, then that is also a problem in breathing. And range of motion of the rib cage. Each rib has to move beautifully. So otherwise it won't synchronize with each other. Then also there is a problem. And specifically, all these ribs are attached to front and back to the spinal cord. So the length of the spinal cord is very, very important. And the posture of the spinal cord is very important for better breathing. So the breathing regulating factors are mechanical process, motor behavior, synchronized muscle work, patency of airway, range of motion of the rib joints, and spinal range of motion. Okay, this is one of the beautiful slides. The phrenic nerve is, I said, it is both motor as well as sensory. So it is motor means it is going to activate your diaphragm muscle and your intercostal muscles, and also it is going to create a sensory impact of signature on your pericardium as well as your diaphragm. So basically, as well as the pleura. So pleuritis, pericarditis, during this time the irritation is happening, and this irritation is conducted through the sensory nerve endings of phrenic nerves. So the phrenic nerve is both sensory and motor. It is a very, very valuable point. Okay, now let us talk about respiration. We saw the mechanical perspective. Now we'll see inside alveoli what is happening, the respiratory perspective. So the respiration is a reflex process. How reflex means, if you tap something or if you make the switch, something will on. If you off the switch, something will off. So it is a reflex. So if you decreased or increased pH, so the respiration pattern will change. If the pH is decreased, that means your body become base. And if the pH is decreased, means your body become acidic. And if the pH is increased, your body become base. So when the acid or base, to maintain the balance, again the respiration start to function in a different way. So they can switch on the process of respiration in a different pattern. And decreased carbon dioxide or increased oxygen. So we can call it as hypercapnia or hypoxemia. These two things can again relevant. It can just switch on the change of pattern. And sympathetic and parasympathetic, I told again the stress and thinking pattern and everything. And hormones is also play a very important role. And anxiety and fear. All these things, you see, in anxiety, fear, what is happening? In our body, the cortisol start to produce more. Once the cortisol start to produce more, it produces down your immune system, as well as it is a steroid. So when the steroid happens, the metabolism starts more. So when the metabolism starts, you require more oxygen demand. So obviously anxiety and fear can increase the pattern of respiration. Okay, let me show this. It's a very beautiful picture. I love this picture. So here, if you see that the systemic circulation, equally, that is actually VO2, that is a utility of oxygen, vascular oxygen. It is utility is maximum is by muscles, peripheral skeletal muscle is 27%. Try to understand. The 27% your muscles require the oxygen. Similarly, next highest required is liver. So liver and muscles, they are eating more amount of oxygen. Next, if we take next to them is kidney is 20%, as well as your brain is around 21%. They are near and dear. At the same time, if you see, the heart himself takes only 11%. It's consuming very less. So basically, who is consuming high level? So consumption of high level is your liver and skeletal muscle. So if you want to create oxygen demand, you can work either on liver, it's related to your diet, or related to your skeletal muscles. They can create more amount of requirement of oxygen, so the oxygen can be demand increase can be better. So the connection between the dysfunction and breathing and upper body pain. So how this is a very kind of a topic which is confusing, that what is the connection between the breathing pattern and upper body pain? Everybody must have thought of, yeah, if the diaphragm doesn't do the job well. See, what is the function of diaphragm? Diaphragm is a great wall china between the thorax and your abdomen. When you breathe in, so air is going inside, so diaphragm should go down fully. And if you are going to leave the air, the diaphragm should come up. So when this is not doing its function fully, what will happen means you will start to recruit the upper chest muscles, for example, pectoralis minor, scalenus, sternocleidomastoid, and your masseters and your subclavius. All these muscles you start to recruit. So once you start to recruit all these muscles are accessive muscles for respiration. They are not main muscles. So when you start to recruit all these muscles is not meant for breathing. So basically they are not trained for breathing. So when they start, they are given only for support for a temporary time. I said that the runner, he required for a temporary moment. That time it can act, but it cannot be act continuously. So in COPD patient, it act continuously. So basically this pattern will start to produce a lot of pain and dysfunctions around the upper segment of the body. So the diaphragm is a key. So many people, we don't treat the diaphragm. We always treat about all the skeletal muscles. I agree, that's important. But skeletal muscles are symptom management. You are not going through the root cause analysis. If you go through the KCAT is all about root cause analysis. If you go through the root cause analysis, the major stakeholder is your diaphragm, which is not functioning well. That's why distributed the work to the upper segment of the body. So upper segment of the body is activating too much beyond its level. Unfortunately, these muscles aren't built routine for respiration and they get exhausted and they become tender. That's why you got tender spots. Okay, so hydraulics of respiration, this is a beautiful slide. So when the diaphragm contracts, the dome flattens significantly and it flattened, it pushed towards, yeah.
Sir, sorry to interrupt. There is little background disturbance in the audio. Can you check? When you're speaking, there is background noise coming.
Okay. Switch on the AC. Now you got any background this thing?
It is still there. It is less, but still there.
Now look at this. Now it is there.
No, now it is clear.
It's clear, na?
Yes.
Yeah. When the diaphragm contracts, what happens? When the diaphragm contracts, the dome flattens significantly, and flatten it push down the viscera like a hydraulic plunger. So it's a very beautiful example. Why I use the hydraulic plunger means, see, this is the diaphragm which is on expiratory phase. When inspiratory phase, it flatten, it flatten, it flatten. Suppose if I'm saying Om. So when I'm saying Om, what is happening? It's like this. When I'm doing an inspiration, so it is flattening, 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 flattening. When it is flattening, it is pushing down all the abdominal organs. It is massaging the abdominal organs, liver, stomach, and you have your gallbladder and everything. It is just massaging. So when it is massaging, pushing down like a hydraulic plunger. So that's why I said the plunger. Plunger means it is pushing down hardly to do. So that's why the flattening of diaphragm is very, very important for your digestion. Okay. So what is good breathing? So I always recommend the belly breathing is a good breathing. Why? So we should understand why I'm just recommending belly breathing is a good breathing. So when belly breathing, when I'm doing, what is happening means the diaphragm moves and belly must move. It doesn't move out. You simply are using your diaphragm. Your belly is not coming out. That means your diaphragm is not in function. Simple. So whenever you breathe, your belly should move in and out. So when the belly is moving out, so that means the diaphragm is pushing hardly. So it increases the intra-abdominal pressure. It is pushing the wall out. That is a simple logic. So when you breathe in, so that means you're using the entire chest cavity to fill the air. So what happened means this is like your diaphragm is like an umbrella. So it just open up like this. So when it is open up like this, it push down, plunger, hydraulic plunger, push down. So when I push down, the abdomen just go forward. So basically belly will come up. So good breathing describes the belly breathe, the abdominal breathe, or we call it as a diaphragmatic breathing. So what is the beauty of abdominal breathing means? During this breathe, the belly push out while ribs are stabilized. Ribs won't move, whereas only the plunger will move, whereas the ribs are stabilized. So if plunger is moving along with the ribs are moving, what is happening? Actually, the force won't be effective to push down. So basically, if the ribs are stable and only the plunger is moving down, that is here the plunger means I'm calling the diaphragm is moving down, where this is stable. So what happened means it push all the things forward. So basically the breathe into the belly promote relaxation and manage stress. So breathing belly, why it is? Because when you breathe in belly, you're pushing the plunger. What is that? Your diaphragm. When you push the diaphragm, diaphragm is connected with your phrenic nerve. Phrenic nerve is both sensory and motor nerve coming from C3, C4, C5 anterior rami. So basically it is getting trained. It is getting trained. It is getting stretch and relax, stretch and relax, stretch and relax. So basically it improves your parasympathetic activity. So when it improves the parasympathetic activity, basically you get relaxation. So the belly breath is for relaxation. Okay, what about the chest breath? Chest breath can be adapted for a few minutes or few seconds or very few times. Because reason is when you are more exhaust yourself, you need more oxygen demand. during the time for a moment to neutralize your body or neutralize your acid-base level. For a temporary means you are recruiting your accessory muscles and you are using your chest breathing. So what is the problem in chest breathing? Means in chest breathing your diaphragm is not functioning well. You are just opening the chest anteroposterior, anteroposterior, anteroposterior. So your belly is not working. So belly is not working fully means your diaphragm is not pushing down. So diaphragm is not at all functioning. Phrenic nerve is sitting ideal. So what will happen is this will improve the sympathetic activity. So sympathetic activity is, again, you know what are the drawbacks. So the ribs are lift. So here the ribs will get lift, but whereas the diaphragm stays, only ribs will get lift, diaphragm stays. So the diaphragm has to move, the ribs has to stable. It's a normal. But if the ribs moving and the diaphragm is just not moving, then it's not good one. Okay, this is a difference between the belly breathe and chest breathe. So you can see that in belly breathe, what is happening? The ribs are stable. You can see the ribs are stable, only diaphragm is moving. Whereas in chest breathe, you see that it's both are moving. So basically, this is not a very good one. You can use it for temporary means, kind of. Okay, that's why the Ganesha and Buddhas having a belly. I believe that belly stick out during healthy inhalation. Can see the most statues of Buddha, as well as the laughing Buddha and the lucky Buddha and Ganesh. God breathing and flexible belly are associated with the enlightenment, I feel. So, but actually, the belly breathers, they are belly breathers. They are good actually. And what is why I'm talking much about belly breathing means because I want to come to a point where we are just have some myth regarding reason the people don't breathe diaphragmatic belly because they always want to gut suck in as probably the most popular postural habit in the world, unfortunately. And most of the training centers are insisting push your belly down, push your belly down. So it's not pushing your belly down actually. It's actually it's the training is not actually exactly physiologically matching with that. So on the course, that habit of strengthening, it's not matter of core strengthening means it's not you're pushing your belly back and giving cause a problem to your diaphragm because diaphragm is not able to move around. So this is not a very good posture which is used as adaptive mechanism of many exercises which has been used right now. I think it's a myth actually. Gut sucking is not good. It is going to stop your peristalsis. It is going to stimulate your sympathetic activity. It is going to cause parasympathetic down, and it also is going to have a lot of differences it is going to create. So basically, the gut sucking, or even in photographs, you are just pushing in, and in some of the, and actually in Pilates, actually they are not asking you to suck your tummy in. They are saying that you maintain the tummy in a toned position, but people will take that in other way that they are asking us to suck the belly down. So basically, these are all the drawbacks which in understanding and comprehending and delivering the therapy to the patients. Okay, and so what is other problem? We are not masters in our belly breathing means because sitting is worse than smoking. We all know that because per day we are sitting more than 6 hours in a day. It increases the risk of lung cancer by more than 50%. It is based on 14-year study in US. Basically what happens sitting, when you sit, what is happening basically? So you are actually using more chest breathe as well as you are using less belly breathe because a belly breathe is belly because there is a distortion in the length tension relationship of the muscles. And sitting is no smoking. A life lived mostly in chairs with hips flexed 90-degree, belly compressed from below makes diaphragmatic breathing a little bit mechanically difficult. This is the reason for that. Okay, so what is the alternative? The reverse breathing. At 10 people you see, you pass on the street, 9 of them probably breathing in reverse pattern. Instead of letting the belly out, because it's a social stigma, outward during inhalation, they try to suck in. You just randomly check your 10 patients. All the 10 patients, you don't talk about anything regarding breathing, just look at their tummy and what they are breathing. You just correlate with inspiration, expiration. Exactly, they will have a reverse breathing of out of 10, 9 or 8 people. It is so challenging to inhale while your belly is sucked in, and it is surprising this. It's surprising because it's a very tough process. But how the people are just adapted to that, we do not know. Okay, when we do sneezing and coughing, let us see, or yawning, what is happening? When we are sneezing or coughing, it's a high pressure activity, because it is a sneezing and coughing are it is actually a outcome of pressure against a closed epiglottis. So what will happen? The pressure will be more. It is to open the door up. So every fiber of the muscle attached to rib cage contract violently. You keep your hand over here and cough and see. All the ribs will move. So yawning is not heavy recruiter, but still much more intense than normal breathing. So when you yawn also, it recruits more intrinsic muscles. It is not heavy as breathing, but still it is a strong recruiter of muscles. So the diaphragm is the most important breathing muscle. It always has a work and even relaxed breathing. So even when you are relaxed breathing, diaphragm is functioning. So diaphragm is like a heart. It is keep on continuous working until our death, even at whatever may be the intensity. It is also having a challenges like a heart, but unfortunately it is not getting its limelight like a heart. It's very unfortunate. I want to show this anatomical view. It's very important to understand the functional anatomy, because KCAT is all about functional anatomy and structural physiology. So basically you see here the left phrenic nerve, which is supplying to this is diaphragm basically, as well as this is actually diaphragm, and you can see this is your periosteum, this is actually your pericardium, and this is basically, so you can see there's the pericarditis and the pleuritis as well as the diaphragm. So sensory motor pathway, so it is directly involved. So intercostal muscles, again we should understand, it's a very tiny muscles because between the ribs, but recruit for slightly forced respiration. But this will start to recruit only if there is a forced respiration. Suppose we are doing a spirometer, or we are blowing a balloon, or we are just trying to blow something out, or we are just blowing for test of spirogram. So during that time, we are recruiting more amount of these muscles. Okay, abdominal muscles. These muscles pulls the rib cage down and push the diaphragm up. It's a very beautiful muscle. See, the abdominal muscles, it pull the rib cage down. So that means it can push the diaphragm up efficiently. So basically it's an expiratory muscle, because it pull the diaphragm, it pull the rib cage down and it push the diaphragm up. Reverse action like a pen. In the pen, how the cylinders move down and this moves up. So similarly it works. That is the relation between abdomen as well as the diaphragm. Okay, Quadratus Lumborum. It is one of the muscle. Many back pain patients come that after sneezing, I'm getting a back pain, or sneezing, I'm just getting a pain, it's going around my leg. So coughing and sneezing, immediately we look for a spine. Yeah, definitely spine may be the one of the cause, but most of the times in acute problems, Quadratus Lumborum is a hero, because quadra means four. It's a four side, and it is a lumbar. It is near the lumbar area. This is a low back muscle, and on your what is the beauty means, why when you are coughing or sneezing, already I said coughing, sneezing, yawning are the high force activity. So when you want to give a high force, the Quadratus Lumborum pull down hard your bottom of the rib. People sometimes tear it when it sneezes. Sometimes sneezing time they will get an injury of Quadratus Lumborum. So Quadratus Lumborum can go for injury on sneezing or coughing heavily. So that's why the people believe that there is some fracture of the ribs or something like that if they are osteoporotic. Most of the time microbial tears happens in Quadratus Lumborum. That is the reason they have a pain basically. So what is happening means, you take a monkey which is holding the branches and it is dancing like this. Like this, the Quadratus Lumborum will just pull the ribs down. So similarly, when you are just forcefully, when you do expirate, what will happen? It is pulling down, that is pulling up. So what is happening? There is a chance of tear. So this is the beauty of Quadratus Lumborum. Pectoralis minor. It's one of the muscle. We should not neglect this muscle. I call this as an emotional muscle. Why I call this emotional muscle means pectoralis minor is a very small, tiny muscle just behind the pectoralis major, and it pulls the rib cage in this direction, in this direction, and definitely it's an emergency muscle for breathing. Even though it's a small breathing, it wants to just enhance the area of expansion of the upper segment of your chest. It is just when you require more amount of oxygen, it can just get adjusted. So this is one of the important muscle, pectoralis. Sternocleidomastoid. The sternocleidomastoid, again, the functional anatomy and structural physiology is very important because these muscles are mainly used for neck rotation. That is actually its original work. But when there is oxygen demand, these muscles become a card and start to lift the rib cage up superiorly and sidewise and up superiorly. So to increase a little bit of expansion of first and second ribs and between the clavicle. So it wants to just open up this area. So this is again, the sternocleidomastoid is again one more reason it will create a lot of tender spots, because when diaphragm is not working, when you are using more amount of chest breathing pattern, the sternocleidomastoid is with a lot of tender spots. We treat always a lot of tender spots over here, ultrasound or something like that. We forget, we work on symptomatic management like paracetamol, but we have to work on the diaphragm, which is actually antibiotic. So when you start to recruit the antibiotic, when you start to work on it, it is going to stop permanently. And scalene is other very important and beautiful muscles because it is directly involved or indirectly involved. Directly involved on your upper segment expansion, as well as indirectly it is involved for your basically it is the phrenic nerve passes through scalene. Initially I show the slide. The scalene, it is actually passes through it. So basically the scalene is also very important muscle, and scalene is actually the lungs is suspending, the apical part of the lungs is suspended with the help of scalene with few ligaments. So it's very important. Again, the length tension relationship of scalene and sternocleidomastoids are very common for affecting. Okay, so neck pain and trigger point, now you got the idea. Slowly you are getting evolving the idea. What I'm just going through the process of one by one, I'm just going like a layer. Unfortunately, the most people don't use their diaphragm to breathe. So they have to use their emergency breathing muscle, and inefficient, so they have worked hard. The chronic overuse, metabolically exhausted and painful patches of the muscle is known as your trigger point. So the trigger point of your upper part of your neck is mostly because of your improper utilization of your diaphragm. So exhaling without diaphragm is not a big deal, but inhaling without the diaphragm is a challenge. So strength and coordination. What happened to strength training program of biceps? What we are doing in biceps? Suppose I want to strengthen the biceps. Beginners learn to recruit more muscle fibers. Recruiting lot of motor unit at once takes coordination and physical skill that can only be learned and practice and practice. How we can strengthen the skeletal muscles by practice and practice and practice. Similarly, by learning the breathing properly, a diaphragmatic breathing pattern regularly, we can strengthen our diaphragm too. So recruit more motor units during inhalation. Slowly when you practice and practice and practice like yogic and other people, what is happening means they will recruit more motor units with a less energy expenditure, then their breathing become more efficiency. So similar to, that's why I'm saying it is a motor as well as sensory supply, more or less like a motor muscles training. Similarly, your diaphragm can be trained. I want to give a simple small exercise for this. You lie down on your back with your knees up, place the book square on your belly, take a deep breath in, and the whole book lift up. You can see the diaphragm is moving because the belly is moving out, so your diaphragm, your book is also moving. So if it doesn't lift up, that means you're not recruiting your diaphragm. Suppose if it is recruiting unevenly, what is happening? One side of the diaphragm you're recruiting, one side you're not recruiting. So this is used in KCAT in many patients who come to my clinic. Along with neck condition, I give this exercise as an extra exercise. The law of hydraulics, it is absolutely impossible to contract your diaphragm without your belly sticking out. It is actually a law of hydraulics. So like this I said, you can see this. Pause for some times, then leave it. Very simple exercise. Very, very simple exercises. When he's just taking inspiration, his belly is just bulging out like a ballooning, and he is holding it for some times. And after holding it for some times, he is allowing to fall down. So this is called KCAT book lifting exercises. Visual feedback is how you are going to learn when you're actually contracting the diaphragm. So it gives a feedback for you. biofeedback for you. Now do that at least 20 times in a row. Your diaphragm is strong unless you can lift it at least 3 centimeters every time. Every time it should go for 3 centimeters. When it gets fatigue, it go for less centimeters. But every time you try to achieve 3 centimeters, 6 would be the better or best diaphragm, I can say. So with this small idea of your kind of KCAT way of thinking, I always call that functional anatomy and structural physiology, which is a common word they are used in KCAT. So basically with that, this is an idea. It's a small eye opener. I have a small time, so I want to utilize this time in a better way. So I think I'm just given what you feel. Now you can just go about. Okay, so good. So now this is a small idea I want to share with you all. So I have completed my time which I was given, and I just finished well on time, I think. So now you have any doubts or questions, you can just ask me. I think Swarna madam is online, or Ujjwal sir is also there, sir. Thanks for the wonderful opportunity and best wishes, sir. And I think I can take some few questions, 1 or 2 questions I can take.
Thank you, sir. There are a few questions. Can you hear me? Yeah. One question is, can breathing in prone position helps to strengthen the diaphragm?
Yeah. See, basically the prone position, how it helps basically, when you are doing the prone position, always we read in books that the posterior lobes are getting more space to expand very well. That we know that. So when we are prone, what is happening? Your belly is getting a resistance. When belly is getting resistance, what is happening is your diaphragm has to function against the resistance of the belly. So when it is working resistance against the belly, it is actually a kind of resisted exercise for your diaphragm. But same time, when it is getting resisted, the diaphragm start to open up the lateral thorax. That means your the frontal plane of your thorax is getting opening. So that is normally we don't recruit normal days. So that's why your prone lying ventilation or prone lying breathing is much helpful to improve your lungs. And fortunately, the most of our the posterior lobe is present at most of the lobes are located posteriorly. So that's the reason the apical lobe we get enough space, whereas the posterior lobes we recruited and lateral lobes we don't recruit much. So that's why it is helping us to improve the ventilation.
Okay. How do we measure the diaphragmatic exertion objectively?
So diaphragmatic exertion can be objectively measured. I said that, see, one is I said that you just lie down. I show right now exercise, which is actually you can do it. I said that 3 centimeter is basically minimum you should appear. Suppose I'm just doing 20 repetitions. Suppose 15th repetition I can able to lift only 2 centimeter or 1 centimeter. So that means it is going for fatigability. Suppose it is going for 6 centimeters. I'm achieving the maximum super level of my diaphragm. My diaphragmatic breathing is excellent. So, but if I'm just going only 3 centimeters, 4 centimeters, or 5 centimeters, and again it is fluctuating. So with that idea, we can get the some point of approximately the level of fatigability. And when we start to use more amount of upper chest muscles and we get to have more amount of trigger points, that is also a sign of that your diaphragm is getting fatigue or it's not functioning.
Okay. How we practice this technique in pregnant women?
Okay, this technique cannot be practiced in pregnant women. Because the reason is the book or any weight cannot be kept up on this thing. So, but what you can do means here you can practice this technique. It is not because the human length tension relationship of the muscle is slow adaptation according to embryology of the child. It's a very basic idea in embryology. So basically, get adaptation you can practice. But you cannot do what I'm saying that you keep a book or something. Ask them to keep the hand and ask them to do, because we need some sensory cues as well as we need some biofeedback. That's why we keep our book. The book is not a main thing. The thing is sensory cues as well as you need a biofeedback to understand.
Okay, sir. What is the meaning of reverse breathing?
What is the meaning of?
Reverse breathing.
Reverse breathing means, it's a very unfortunate, we do not know why, most of the people, if we take among 10 people, 8 people are not belly breathers. They actually, even though they are belly breathers, they are not efficient belly breathers, number one. Number two, the big problem is, during inspiration, the belly should swell out. But if you see the reverse breathers, during the inspiration, the belly will go in. And as well as when they are just breathe out, the belly will come out. So this is called reverse breathers.
Okay. In which cases this book lifting exercise is useful?
See, I always give as one of the exercise for anybody who is coming for upper segmental pain. Once I get treated the symptoms, then I thought this is a root cause analysis. So what I'm doing means I want to recruit, if I check the diaphragm, if the diaphragm is correlatingly not functioning well, similarly they have this recurrent problems are coming in trapezius or sternocleidomastoid or scalene or pec minor, all this area comes, then I just recruit this exercise, one more additional exercise to them to add on to prevent it for further recurrence.
Okay, sir. How to train the can we use this exercise for cervical problem?
Absolutely, you can use it. It will give a very good impact.
Okay.
But same time, when you should take one care that the positioning of the patient and should not, during this exercise, he should not recruit, he or she should not recruit the neck muscles. It should be kept relaxed. Only our aim is to improve your diaphragm. So once you automatically recruit the diaphragm, it starts to lose by itself.
Okay, one more last questions. Can you explain about the clamshell breathing exercise?
Clamshell.
Yes.
See, basically clamshell breathing exercises is, I don't have much idea about it, so I cannot comment on it.
So that's for all. The other questions we'll ask later on. We are running out shortage of time. Thank you, sir.
So
I'll
again,
hand over to the Dr. Darshana.
Yes, ma'am. Can I share my screen?
Yeah.
Is my screen visible, ma'am?
Yes.
Am I audible?
Can you just little bit speak aloud?
Yes. Am I audible now?
Yes.
Yes. I would like to thank all the participants for attending this session. I would like to sincerely thank Dr. K.M. Annamalai, sir, our speaker for today. Thank you, sir, for sharing your knowledge and experience on upper segment pain management through breathing techniques in KCAT way. My sincere thanks to our IAP President, Dr. Sanjeev Jha, sir, and IAPWC National Head, Dr. Ruchi Varshne, ma'am. Thank you for this venture for upliftment of our field. I would also love to extend my thanks to Dr. Pooja Kamble, ma'am, Dr. Ujwal Yevle, sir, Dr. Suvarna Ganveer, ma'am, and the entire Maharashtra state team of IAP as well as IAP Women's Cell for their constant guidance, which is actually made the session a successful one. Last but not the least, I would also like to thank our IAP technical team. Thank you once again, and please do share the feedback form which is already been shared on in the chat. This is for YouTube as well as the Zoom. Please do share the feedback form. And last, I would like to tell everyone to please register yourself to IAP, that is Indian Association of Physiotherapy. Thank you, one and all.
Thank you, sir.
Thank you, Snail ma'am, and thank you to Suvarna ma'am and Ujjwal sir, Pooja ma'am, and the entire EASY and entire team. Really thankful. Thanks for the wonderful opportunity.
Thank you, sir.
Thank you.
How do you, sir?
Thank you, sir.
Thank you. Thank you.
Yes.